ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਤੇ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਜੀ ਆਇਆਂ ਨੂੰ। ਮੇਰਾ ਨਾਮ ਹੈ ਹਰਲੀਨ ਚੌਹਾਨ ਤੇ ਤੁਸੀਂ ਮੈਨੂੰ ਪਹਿਲਾਂ ਦੇਖਿਆ ਹੋ ਸਕਦਾ ਹੈ, ਪਰ ਅੱਜ ਮੈਂ ਤੁਹਾਡੀ ਮੇਜ਼ਬਾਨ ਹੋਵਾਂਗੀ। ਅੱਜ ਦਾ ਸਾਡਾ ਪ੍ਰੋਗਰਾਮ ਹੈਗਾ ਤੁਹਾਡਾ ਸਿਹਤਮੰਦ ਬੁਢਾਪਾ ਤੇ ਉਸ
and we'll talk about that. So, before going forward, we'd like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, and Tesla peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of these lands. As I told you, I'm your host, Harleen Chauhan. I'm a pharmacist. And let me tell you about digital medication. What does it iCON mean? It means intercultural. We are associated with the University of Digital Emergency Medicine. What is our purpose? To assist multicultural and indigenous citizens, patients, and caregivers, and the community at large about chronic diseases, to help them. And if you're living with somebody who does have chronic diseases, we can help you with that, how to take care of them. We also want to tell you, in the age of internet today, that what you're reading there in news or on YouTube, that all that information, how you should look at it, does it belong to you or not, and you should trust it or not, and what things you should not trust. And last of, we want to tell you that about our healthcare providers, the people who provide you healthcare, and yourself, how to have a good communication between them and how to improve it. And that's example today. And we are here, your caretakers are your speakers today, and you can ask them questions. We will start today with our opening remarks.
Thank you for the opportunity to provide opening remarks at today's Strengthening Health and Wellness as We Age forum. I'm Lindsay Arscott, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health, and I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with this land continue to this day. The Ministry of Health's Patients as Partners initiative believes that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but it is an effective way to make the health system better and the people of BC healthier. This philosophy is summarized by our motto, "Nothing about me without me." Patients as Partners has collaborated with and funded iCON for about 15 years with Dr. Kendall Ho as the executive director for all of this time. iCON continues to bring healthcare providers together to speak with people in their first languages about topics they want to learn more about. And today, that is about how we can stay resilient and as healthy as possible as we age. As we age, the risk of being frail increases. However, getting older and frailty are not the same thing. By taking a holistic approach to health, you can stay healthier longer. For example, Cardiac BC states that about 90% of premature heart disease can be prevented with good health practices. Additionally, a recent study by the U.S. Centers for Disease Control and Prevention found that the evidence demonstrates that the strategy of self-management and educating ourselves achieves desired outcomes in multiple chronic disease contexts, including diseases of the cardiovascular system, diabetes, asthma, and arthritis. So there's lots that we can do. I want to thank iCON for bringing us together today, and I invite you to check out the resources after this discussion. You will find information on self-management, eating well, staying active, building resilience, and many other topics. There are websites where you can enroll in self-management, health coaching, and other peer support programs that provide information, skills, and support to help you achieve your health goals. Some of these resources and programs are provided in different languages to make them more accessible. Also remember that encouragement and support from working together as a family and in the community can make it easier to make these health changes. I want to express a big thank you to iCON and our presenters. I appreciate your time. I want to thank everyone for attending. What you do for your health can make a big difference. Thank you. Have a great session.
This was from the Ministry of Health, a couple things. The things that she said that I want to bring into your attention that my health is in my hands. Otherwise, there is no health. So what you can do with your health and to decide to make judgments about your health.
Now we will talk to how to plan ahead, planning ahead and accessing support for our next speaker, Sarah Basra. She's healthcare social worker of Fraser Health Care. And palliative care means when the last moments or months or days of your life, she works with that team. Serb is a master in social work from UBC. Her mother had advanced Parkinson's disease. In December 2023, she passed away. Serb was the main caregiver for her mother, and she's a healthcare advocate for so many other issues. She can help you with that. Serb, in her personal life and through her profession, she has a lot of experience. And to talk about all that, what are the things that are happening in healthcare profession, especially in Panjabi community, and which are beneficial to us in healthcare. She also wants us, if there's anything in healthcare, if we are feeling fine, or go there, or should we go there when we don't feel fine. For both these times, you should get the care that is beneficial. And now I welcome Sarabjit. She should come and tell us about her talk.
I will welcome now Gandip Sidhu, who is Master's in Science in Nursing, Program Coordinator, South Asian Self-Management Program, University of Victoria. If she can come to the stage and welcome her, and then she will give us some information. Greetings to all. As you know, I am Gandip Sidhu. I am a program coordinator in the self-management program. I am a coordinator at University of Victoria. You you hear all the educational sessions, lectures. This is the first group that you can gain support from. So I'll let you know who we are. First of all, you talked about chronic condition, and I'll give information about self-management. What are the programs that are available in BC, and who can participate in those programs, and people who are attending, what positive effect they have on their life or health. You can also volunteer with us, and I will talk about that a little bit. And lastly, how you can register for the program. So chronic condition, the chronic conditions are the conditions that are ongoing for long time, and for that you have to change your lifestyle alongside with medications. Chronic health conditions are ongoing, such as diabetes, arthritis, lung illnesses that go for a long time. The symptoms are common in most of these diseases: pain, fatigue, shortness of breath, trouble sleeping, depression, fear, and isolation. So people who are working in a normal routine before the disease, and we are unable to go on the same level we used to do before the illness. So what is self-management? It means you are diagnosed with your illness, the treatment is going on, how you change your lifestyles to cope with your illness and how to live a better life. That's what we teach, and you will be able to learn that in these classes. Now, we talk about that. We are the University of Victoria, is the center, but it's located in Delta. We started in 2002 the satellite center is a multidisciplinary research center. There is a research program there, and then whatever the outcome of that research, we offer those programs in the community. So our main goal is to improve the health by with the changes of lifestyle, so that people can we coordinate with healthcare professionals, we coordinate with health sector, so that whatever challenges we in whatever challenges and potentials of an aging society, so how we can help people. So basically the self-managed programs were developed at the Stanford University as research projects. Now it's more than 25 countries. These programs are implemented around the world. In BC, self-management program is funded by Ministry of Health, and as partners and health patients as partners initiative. So they are all free of all the programs are free of cost. Since 2000, our programs have been delivered in 160 communities around BC. So why we need this program? Because every 1 in 3 British Columbians have one or more has the chronic, one or more than one has chronic condition. So it's a burden on health sector, and health system is overloaded, and in a year on average you can only on average people with chronic conditions see healthcare professionals 6 hours per year. If although he's a family doctor specialist, otherwise you are in your driver's seat. How you manage your chronic condition is entirely up to you for the rest of the year. Next is which programs are available. There are different categories. We can say it a self-study program. Second category is a group program. They are either in person, or you can go there and attend the class, or you can attend them virtually on the computer. Third is the independent online study, and fourth is health coach program and frailty coach program. So first let's talk about toolkit. This is an independent approach. Like for example, there is a no group facilitator or teacher. They will send you all the material at home. There will be an outline what you are supposed to read, and it's your responsibility. You read it, or whatever changes they want you to bring in your life, you can do it on your own. This is called toolkit program. We give you a booklet, we give you CDs, and the program those are available for chronic condition, chronic pain, diabetes, cancer surviving and thriving. These categories are available in English. In Panjabi toolkit, there's a tool for that's chronic pain and diabetes. The toolkit that's available in Panjabi. So the material is available in Panjabi, and we send it to the patients. The booklet that's in English, there is a snap. There is a picture, diabetes program toolkit, and these are two resources we include to send at home. Next is, second is, there is a group program. There are two types. You can attend on the Zoom, or you can do it in person programs. You can attend where the classes are taking place. In Surrey, we have a partnership with the diversity. The classes are there. The Candy Senior Center in Delta, Senior Centers in Richmond and Vancouver. The classes are also held there. So this program is a 6-week program, and one class is 2.5 hours every 6 week. If classes start Tuesday, you have to go once a week every Tuesday, and it will go on for 6 weeks. There are 8 to 12 participants. Sometimes there is a bigger group. We have done it up to 16 participants. And the group programs is for chronic condition, chronic pain, diabetes, and cancer, thriving and surviving. These are the classes that are offered. For Panjabi, a program available in Panjabi is chronic conditions, diabetes, and chronic pain. And the source material we get is Living a Healthy Life with Chronic Conditions or Chronic Pain book. It depends which program you are registered in. And same format, when we don't go in person and we do it on computer, we call it a virtual program. When you do it on the computer, there is only a little difference. Instead of 8 to 12, there are 6 to 8 participants because it's online. Because it's now not a face-to-face contact, and it's easier to manage the smaller group. The next program,
Better Choices, Better Health Online. That's also a 6-week program, and Zoom classes are different in there. That Zoom class, it's not particular time. With this program, you can log in on the computer according to your own availability. It's on every Monday, and then the homework is assigned. And during that week, you can attend on your own. And those programs are only available in English. And source book is same, Living Healthy Life with Chronic Condition. The next one is Health Coach Program. There's a coach there. It's 1-to-1 pairing. And their trained peer coach calls the participant and the pairing. It's for 3 months. And the duration of the call is 30 minutes, one session. And they set the goals mutually. And then they guide them through what are problems they're having. And that's a Living a Healthy Life book is available. And the initial assessment, if there's a chronic condition, and they'll give them a booklet, and then there's a different book with the chronic pain. And it's only available in English. Next one is Frailty Coach Program. It's associated with the Health Coach Program. The difference is, and it's based on prevention of frailty in old age. It's very common. Its program is also available in English, not available in Punjabi yet. It's a 13 weeks pairing, and 30 to 40 minutes call each week. The coach guides you, the person, and what strategies they need to use, avoid strategies, and how do you apply that in your life. And these are 2 books that I mentioned earlier, Living a Healthy Life with Chronic Condition and Chronic Pain. And next question is, who can participate? Anyone who's living in BC, 19 plus. We have also program for seniors, but anybody over 19 plus can attend. If anybody has that condition, chronic condition, they can attend. And the caregivers can attend as well. And there's no need. And next one is participants. They can see what is the first step to take. If there's isolation, nobody's talking to anybody, they want to live in isolate, then how decision making, anger, fear, and isolation, how to deal with it, and action toward goals, working with healthcare professions. Next one is who attended. They said the program is really good. Their health improved. They were able to manage their symptoms very well, less distressed, and their daily activities, they are less limited in their daily activities, and the life expectancy also got better. Chronic conditions self-management program, the outcomes were hospital visits went down, and with that, it's also reduction in health cost utilization. And program you can do it English or Panjabi or Mandarin or Mandarin. Effectiveness was same. Format is in person or toolkit, and the set has same effectiveness. Until now, more than 1 million participants have across the globe attended these programs. And we also have volunteer opportunities available. If you want to volunteer, you can join, submit online, and there are two options. You can do in-person 4-day training or attend 13 virtual attendance. After attending that, if you have completed the training successfully, then you are certified. You can work with us as certified volunteers. Now more than 7,000 leaders and health coaches trained, and more than 60,000 participants have attended these programs. And how to register and to get more information? You can email me by contact. My information is available. Phone number and email is available there. And website is available. Website www.selfmanagement.ca. Our phone numbers are in Lower Mainland and toll-free line as well. And website address same. And for Panjabi programming, you can contact me directly. And the key points of my presentation are: the programs are offered at no cost. It's free. It's available in different formats. You want to get a toolkit, attend virtually or online. And programs available in Panjabi, chronic condition, chronic pain, and diabetes. And lastly, no referrals are required to attend our programs. You can call us directly, go on website and register. And these are community resources. And I have one more request. You know about the program. Please tell your community about these programs. If you think somebody else can attend and can gain some benefit from this, it's really important. Thank you for that. That was my presentation. Thank you.
So now City of Surrey wants to come and tell you about how many resources are available there. There is a pink survey in your package. So you have to write your answers of this survey, and in the blue we will collect them. All right. So start filling out the pink one. Blue one we will collect. Now I welcome City of Surrey. and they will let us know about the city resources. Welcome everyone. I'm healthy aging. I'll talk about the healthy aging, um, about that program. So Surrey is an age-friendly city where people can engage. So we launched the aging guide, active aging guide for the elderly people. So whatever activities are available, my Punjabi is not that great. This guide you can read it in Panjabi. What activities Surrey city offers. So there is a little bit in there. If you can't make it in person, you can attend online. Our walk-in program is very good. It's very good. It's done by volunteers. So once it's over, you have a social gathering. It's your social circle. You can socialize. There are programs. If you want to walk, you can try different sports, games, and connecting generations is a very popular event. You can either women or men gather together. You have to sign up. So you meet up with each other with the same age, your topics, where you came from. You can have social connections. This is our website. City of Surrey has changed it. It's a drop down menu. You can read it in English or Punjabi. You can sign up here. So whatever topics that interest you, new recreation events, museum, there is an email address, and you can get information also. So there is Bear Creek Pavilion. There is a community hall there. In this community hall, there are many events. A lot of people know about it. There are you can make social connections. You can drop in. Whatever you like, you can do all these kind of activities. These are all the community centers in Surrey. If you want to go there, and that's all. Thank you. Very quick. If you need more information, we will be here. Thank you so much. All right. We will start from Kuljit. First question. I don't have extended medical care. Where I can get subsidized physiotherapy? Yes, subsidized physio. There is some MSP coverage. There is coverage under MSP. It's a little bit tricky. MSP coverage. Some physiotherapists they don't take it this portion. You can see online. Online if MSP is covered. The 10 physio sessions government provides in general, but it depends which physio takes it. Sometimes we are expensive. We spend 40 minutes to an hour. Government whatever the government pays, it doesn't make sense for us. So we don't pay attention to our health. But if we are buying clothes or something like that, we don't focus on our health. We should focus on our health and please write down your question. You mind? If you write it, I'll read it. I have so many questions. We will come back to the question, Kajit. Vaneet. one serving of chapati or roti, how much gluten-free flour or oat flour should be, how many carbohydrates, how much protein, how much fiber we are supposed to take. Harleen, if I understand the question, in one roti, how much gluten-free or oat flour should be? It depends on you. I don't use gluten-free or oat flour. Why you are using that flour? I can base my answer on that. If you have a condition, that's why you are using gluten-free or oat flour. I just need a little bit more information. The second question, how would we know how much we are how much carb, how much fiber, how much protein we are supposed to take? According to Canada Health Guide, if you go online, we used a plate method so that you don't have to think, you don't have to do the calculations, you don't have to remember the numbers. You try, if you are eating in a plate, a handful of your fist, like you eat that much protein, like we can eat one bowl of kidney bean flowers or chickpeas, and a lot of like kidney beans, not that half of it is liquid. So so whatever protein you have, the quantity you have, like the quantity of lentil soup or kidney beans, you can have same amount of roti, quinoa, millet, grain, any grain, same amount of grain. So that will be half of the space on your plate. So same amount, you can have double the quantity of your protein. You can have vegetable or fruit on your plate. You can, for salad, cucumber, tomato, little bit of onion, couple spoons of chutney, and little bit of yogurt and spinach in your chickpea curry. If in your plate, if you use this proportion, just keep place protein in your plate, and then same amount of grain, and then double the amount of fruit and vegetable, then you can have a guarantee that you have enough protein, fiber, carbohydrates, and fats, and you are having vitamins and minerals in a day. So this is a very simple formula for this. If you need specific numbers, that how much requirement for protein, you can see a dietitian, and they can assess your diet. If you need more carbs or if you need more protein, you can take a referral from your doctor, and then you can see dietitian is not covered through MSP. You can contact who are in a private practice. There are a lot of dietitians doing private practice, and you can also, Harleen will tell you, you can contact the dietitian through 811. There is another question for Kaljit. What kind of exercise we can do if there is pain in the knees? Second question about the knees. If there is already problem in the knees, can you go upstairs, downstairs? Can you do the stairs? Yes. I put those exercises in the sheet, the band one. You put the band on the your leg, and then you tie it with another thing, and then it's very important strengthening your legs. Second part, second, if there is knee problem, depends on what kind of knee problem. Sometimes there is arthritis, there is no ligaments, So everyone has to talk to the physiotherapist and go accordingly. In general, the normal activity like everyone can do stairs. It's not that bad for us. Like squats, as I taught you, the sitting on the chair exercise. You have to do every day in your life. Doing the stairs, it's not that bad. In the beginning, it will be difficult. A couple of weeks, it's not make a big difference. So with the step exercise, there will be no more damage. It could be sore, but no damage. Please talk to your physiotherapist. And everybody has a different medical history, so talk to the physiotherapist. Next question I will answer. I just moved to Surrey from Richmond. How I can find a family doctor? It's very hard to go to a drop-in clinic. If you want to, so Surrey North Delta Division, there is a website, there is a wait list, you can go there. The second thing, Help Seeker and Map, you can find a family doctor there. There is a Health Connect registry through BC government, you can find a family doctor there. If it's too difficult to do that online, you can dial 811 and talk to them. Next question is for Vaneet. It's about milk and flour. Which flour, millet or wheat, which one is better? Second is about milk, a lot of questions. Which ones are safe? Canadian milk is safe. Canadian milk products, people who have heart disease can take milk. Milk is better or the curd is better? It's like milk or curd.
Look, we are here mostly sick. I'm sick as well. We believe in one. We don't believe in the duality. Nothing is good or bad. Everything is good. Depends on how you use it and for what reason. And that makes it good or bad. If wheat is better or millet, both are good. We should eat both actually in our diet. First, if we look at it, in older age, we were not just eating wheat. When it was wheat season, we ate wheat. When there was millet, we had millet. And if there was a corn available, we ate corn. There was a variety. So variety is really important in our diet. Milk product, Canadian milk product are good or bad. In our country, Health Canada regulates everything. My aunt and uncle, they work in those organizations. Whatever we eat and packed, that's sent to us, it's safe for our consumption. Milk, yogurt, butter, the products we get, those are safe for our consumption if we store them well. They are all good for us. Swallow. If you have heart condition, milk or yogurt is good. Can you eat it? Yes, you can, but in moderate quantities. Milk is good for our bones. It's very important. We talked about it. And yogurt, there's milk, and we also fortify it. We got calcium and vitamin D, vitamin A as well. So all those vitamins are included and are good for our good health. That's it. And milk and yogurt, please include that in your diet. Next question is for Kashmir Bisla. First question is, if somebody's here for super visa in Canada, are counseling services covered for them? Okay. Counseling services, if we are working, if we have health benefits, extended health benefits, through extended health benefits, dental, eyeglasses, You can use it for that. We have to check it. Mental health services, if we have it or not. There must be dollar amount, like how much, 5,000, 10,000, how much you can use a year. And you can choose your therapist. Or if you don't have extended health and you can't use that, then the low-cost services are available in Surrey. For example, Moving Forward Family Services, they do student counseling, and you can do low-cost counseling. I don't think there's not much available for completely free, but through government, there's no 100% free services available. But our association is trying, as you said, as you go to the doctor, you don't pay any money. We want, if somebody needs a therapist, it should be same, that you should be able to get an appointment, so you won't have to pay. We admit that these services are very expensive. It seems like it to many people, but as Kuljit said, we spend money on other things. We can spend on our health as well. Second question is for Moving Forward Family. Some audience was saying it's closed. They got you. Moving Forward, I met their director. They're not closed, but sliding scale. If you can pay full price, if you can pay only $20, $25, $50, according to your income, they can do it. So now we go back to Kuljit. There's a question lined up for everybody. So I'll ask the question a question for you. First question. I had a knee replacement, and the surgeon said they gave a 10 physio coupon when they went to Coop. They did not honor it. They refused to take those coupons. Any idea about that? First of all, we have private practice. Surgeon, if they work with a physiotherapist, MSB coupons they provide to you, then that's for the same physiotherapist. That's the same thing. Where they sent you, for what reason, and who takes those coupons or not. It comes back to same. If it's on the coupon, you need to ask the surgeon. The surgeon writes a referral. There's 10 sessions needed for. It depends. It depends what was written. Second question for you is, and somebody had a stroke many years ago. One side, when they try to pick something, they're feeling something that they're holding. Brain knows they're holding. Seems like the connection is not well enough yet. Can they build strength for that? Stroke. Neurological, it's called neurological, it's with the nerves and brain. It's related to that. When a person gets a stroke, sometimes, there's a blood clot that goes to your brain, and there are thousands nerve that goes to the body. And when there's stroke, it impacts your, if the stroke was on the right, then it affects your left side. You have that stroke. We didn't talk much about the nerves. The nerves, it takes some time to get those back. Generally, when we talk to the patients about the resources, 1 millimeter, where it's very small, you get feeling back in there. Depends, the extent of the stroke. Though you can focus with your brain, neuroplasticity. You make new connections. If I haven't seen the file, it's hard for me to give you advice. but encourage them. Use the arm as much as they can. Don't give up. Keep using it. Next question is about the knees again. Somebody had a knee replacement when pain went, but 10 years later pain came back. Can something be done about that? In old times, knee replacement was only good for 10-15 years, but now patients are keen and they want to get a knee replacement. Sometimes they're only 40-50 year old, and then we tell them don't do it yet, do some exercise, prolong it. If you get a knee replacement in 40-50 years, you're gonna have to get it done again in few years. It depends on the pain as well. In my experience, sometimes the patient feels like it's a payment. It was the same knee pain as it was earlier. In our culture as well, it's a misconception that we change the knee, it's all good. If you got a knee replacement, you need to do exercise to make the muscle stronger. The muscle takes time. The muscles are taking time to get stronger. It can take 3 months, 6 months. So keep doing exercises to make it stronger. It's not like a car. You change a wheel, it's all good again. Yeah. Next question is for Vineet. So many questions, but don't have time. It was from online. Meals on wheel. Hospital food, you talked about it, $5. Do you know if it includes Panjabi food for seniors? Depends, which hospital you're talking about. Right now, we're trying. Panjabi are intended with culture-specific meals. We should try to include it. It's my understanding in Surrey, Abbotsford, Vancouver, in some of the hospitals, the food is available, especially culturally specific meals. If you are unable to get it, the hospital is not able to get it. At the same time, you can talk to doctor or dietitian or nurse. You can ask them that you need meal that are culturally specific. The hospital $5 meal. It's fairly new. I don't know much about it. As Kashmir said, there are so many services. You need to ask. If you're not unable to get a service, if you want it, ask the team that you need it. Next question. Healthy eating and overeating, what's the difference? That's a good question. Healthy eating, what we call it when we eat it. When you finish that meal, you should feel that you got energy. Then you refuel your vehicle. It can go up to overeating is you ate too much and then you feel like you should lie down, sleep. That's overeating. That's the difference. So try with your meal. If you're feeling dizzy or sleepy after eating, you should get energy after eating if you're eating healthy.
ਦੇ ਬਾਰੇ ਹੈ
Next question is about salad and fruits, like how many. So you can have salad in the dinner. Is salad and fruit? It's a very good question. Usually we, in like people come from Punjab subcontinent, there are fruits that our already taught us when you wanna eat yogurt or when you wanna eat fruit. That's but in Western science, according to that, there is no restriction what time you can eat fruit or what time you can eat salad. There is no restriction. But if you feel like if there is a problem, then you can change the times if you feel any problem. According to the Western science, whatever we get to know, there is no problem. Anytime you can have salad. Whenever you feel like to eat salad, you can eat it. Health wise, we recommend before eating, before eating your meal, eat your salad, so that you will, it will satisfy your hunger, and it will be, we won't get constipated fruits with, if when we eat fruit and salads. So we can change our time if there is a problem. 2% or skim milk, which one? If you are 65 and above, then we should have nutritionally dense diet. So whatever we could put in the like quantity wise, so that time you can have 2%, even whole milk, you should have it, so that you can get as much as protein. But if you are younger, and if you have any other conditions, heart condition, then you should still 2% is fine. Then you will get enough protein, calcium, vitamin D. But yeah, you shouldn't try whole if you have heart condition. Otherwise, it doesn't matter. Next question is for Kashmir. First question is this: if someone has depression and they are already on antidepressants, and what if counseling will make any difference in that situation? First, we all felt like just take a pill and magically the problem will solve. We have that misconception. You take your medications, you do exercise, you take counseling, you also need pay attention to nutrition, fix everything, change, bring changes, and then depression will go away. And you can reverse depression. Counseling, sometimes those people are around us, we can trust enough to talk about something that's in our mind. And counselors always keep your conversation confidential, they will not let it out. So even if with the family member, so they will not talk outside. So if you think the counseling will make a difference, it's a judgmental question. They are just asking to learn anxiety, to feel nervous. Anxiety, is it a normal? Is normal since when is a problem? Since when it becomes a problem? If we keep our messages, our senses negative, when you think about it, same and same negative messages, to keep on telling yourself a negative message, then it becomes a bigger problem. So for that, you can, through counseling, there are techniques where you can teach yourself how to change your brain, your behavior. So sometimes you think I have tried everything, but sometimes when you talk to a professional, then you learn new things, learn new techniques, then you can change the situation. These were our questions. Thank you, everyone. Again, a very good question. I'm saying this on the stage is a bit tough. The dates that are written on the box, once we open, like for example, milk, and if milk is open and it's on expiry date, very likely that is near end. So that milk, try to use it at the same time or freeze it. You shouldn't be using it after the expiry date, but sometimes we smell. Is it okay? Is it not okay? We don't know. There could be microorganism in there, so we can't see it with eyes. If the box is closed, you never opened, the seal is never opened, then there is less risk because it's vacuum sealed. So then you can open it and use it in 2 to 3 days. It depends how long it has been open for. Again, once it's opened, you should use it 2 to 3 days. Make paneer, freeze it if you cannot finish it. Maybe this is the last question I take. The frozen meals, if we freeze them properly, their nutritional value also freezes with it. So, for example, frozen peas, frozen sag, if you heat them again, we will get all those things when they were freshly made. So the frozen meals are really good if we really look cost wise. They are cheaper, energy wise also good, but there shouldn't be any added things. If you freeze vegetables, fruits, just that fruit, just add a vegetable or homemade food is helpful and is good. Second question that you did, after eating how much exercise, how after eating how after how long? I'm born and raised in Canada. My education is also from Canada. So we have the same debate. In India, Punjab, there were rules about these things. In my education, there is no, it doesn't make any difference after how long. If you don't go for running after when your stomach is full, but once things digested, people after eating, people go for walk. Just it reduces your blood sugar, aerobics, easy, maybe half an hour. You can do it. Every individual has their own things. It's not that you cannot do anything because you fell asleep. Everybody has different system. It's not a big medical region that you cannot do exercise. Yeah, we call it carbohydrate loading. Some meals have more energy, they provide more energy to run, like pasta, something like that. If you sit down, you will get fat. It's for that. There is a difference. Some people have different. The athletes have different training, different situation. Yes, they can do it. Now we will stop here. The questions, the time, we passed the time. Thank you. We learned a lot about diet and exercise. Now we thank you, our community partners, Alzheimer's Society, BCNL, Choose to Move, Diversity City, Guru Nanak Free Kitchen, Guru Nanak Free Kitchen, Fraser Health Options, PRIX, City of Surrey, University of Victoria, Surrey North Delta Division of Family. So our media partners, I will not go again and again, they all are here. Thank you to our health exhibitors, people you met during lunch, our speakers who came here, and they helped us a lot and they gave us so much good information and we made them lead. Thank you. So thank you to our interpreters today who were interpreting in English, our suppliers, LMB Systems, Surrey City Hall, Star 76. All of you, thank you so much.